Good afternoon, everybody. Victoria. I'm Victoria. I'm an advanced nurse practitioner and I own Elysium Aesthetics, Health and Wellbeing in Fakenham in North Norfolk. I've had lots of inquiries this last week or so about tear trough fillers. People often come in and they'll say, I look tired, I look run down, I look a bit puffy, I've got dark circles under my eyes, or I'm beginning to look hollow under my eyes. Tear troughs are a fairly advanced treatment, so understanding the anatomy of the tear trough is incredibly important. So you have skin, fat, and then you have a retaining ligament that goes all the way around here, and the muscle, and underneath that you have another layer of fat above the bone. So if you think about that as layers from the bone, fat, muscle, fat, skin, basically. If you think that as a basic concept, what we need to do to improve the tear trough, which is this area here, you can see mine quite clearly there, is to get to that lower fat pad, and it's called the SOOF. You've got the roof up here as well, which always makes me laugh, I don't know why. Anyway, we need to get hyaluronic acid into that really deep fat pad, which is quite thin under there. Danger zones, you have a facial artery which comes up here, which we do not want to damage. So the most important thing around this treatment is safety. We use cannulas here because cannulas are the safest way to inject into a fat pad and through all of the other structures that can be punctured with a needle. So for areas where you have where you need to go fairly close to a vessel, although the vessel is in the terms of aesthetics a long way away from where we're injecting, we still need to be incredibly safe when we're injecting into the tear trough, so I use cannula. This procedure is very effective and very natural looking if we use the right filler. I've had numerous people in here who have had filler either injected too superficially or the wrong filler injected, so that they then become puffy. Where they had a hollow tear trough, they're now puffy. Somebody came in a few weeks ago and said that they felt like they had slugs under their eyes where they'd had tear trough injected, not by me. So knowing your aesthetic history and surgical history and everything else to do with aesthetics is incredibly important. So when I ask you to come in for a consultation prior to having tear trough treatment, especially any of the treatments I do, but especially tear trough, it's very important that you're incredibly honest with me. So sometimes people would come in with for tear troughs. They've had tear troughs treated somewhere else, and I want to dissolve it before I'll treat them, and that just makes things much safer for you because it avoids or reduces the risk of complications. So tear troughs as a standalone treatment is this area here. My favourite product is Redensity 2, made by TEAR. It's less hydrophilic than other fillers, so it won't cause puffiness as long as it's injected by the right practitioner in the right way and in the right place. Sometimes people come in for tear trough filler, but it's actually not the tear trough that needs treating. So understanding that if there's hollowness here, that's great, it's fairly straightforward to treat as long as it's safe to do so. But sometimes people have puffiness there, but it could actually be caused by the fat herniating through that little muscle and causing this area of real puffiness, but it's not caused by fluid or by tiredness or anything. It's actually caused by the fat herniating through, and it takes somebody who knows what they're doing to recognise that. So if it is herniated fat that is coming through, we can't treat it with fillers. We have to refer you to a surgeon for removal if that's what you want to do. Other things that it might be because of hollowness here in the malar fat pad, or it could be that actually having some treatment in the cheek zygomatic area would actually lift and reduce heaviness around here. So when I look at the face, I'm looking at the whole face, not just that somebody's coming for tear trough, but I want to know what has caused the need to have tear trough filler. Is it safe to have it? Have you had filler elsewhere? Have you had surgery? Are you medically fit for filler? Is it because you've lost fat here? Is it because you need to have contouring? Or is it just that you need tear trough? Or do you need a combination approach? Sometimes people have just real dark circles here and actually they don't have any hollowness, in which case I'll be advising good skincare to include something like alumini, which contains lots of ingredients that will break down the haemoglobin which builds up and sits in the skin. But again, it could be a combination. I might suggest that you have alumini, tear trough fillers, some neurotoxin, some cheek fillers and some mid-cheek fillers. It really depends on each individual person. But one of the reasons you might come and see me is because I've been doing this for such a long time. I've done a lot of studying. I'm as qualified as you can be in aesthetics, and I would hope that you would come and see me and take my advice about the best course of action, even if it meant that I refer you elsewhere.